Donna Gambino. I'm a licensed physical therapist and a certified Pilates instructor, and I'm here today to tell you not to lock your knees. So why do I need to tell you this? Because any type of change in posture can cause problems throughout your whole body. So I was at a resort recently and I got to witness a wedding and see all the ladies in their nice cocktail dresses and their nice high heels. And I noticed how so many people, including men, were locking their knees when they were standing, just chatting, having their cocktails. And I got to thinking I should really talk about this. This is a big thing and this is a huge thing in posture that I see all the time. So wanted to give you a little information about this and talk about how it can really affect your whole body, and especially something that a lot of people suffer from and you wouldn't even think it's maybe coming from your knees. So what is it called? It's called genu recuvatum. I can never say that word right, or hyperextension of the knee. And it's when we lock our knees back when we're standing. We're not going to talk about the injury type of hyperextended knee today. That can be caused from a sports injury and it's a whole different thing. This is more habit hyperextension, okay? And it looks like the pictures that I'm inserting here in the video where you lock back your knees when you're standing and it looks like your knee is bowed backwards. And it's really a way to stand without using any muscles, okay? So it's a lazy way to stand. And I think it's because, you know, when we're standing for prolonged periods of time, whether it's in a store, at an event, or when we're doing, you know, washing dishes or doing things like that, where we're standing for a prolonged period of time, it's a way to rest our muscles and not have to use them. And we get to just rest on our bony endpoints and on our ligaments, which causes a lot of strain. So you can see what it looks like. And let me tell you now, what are the causes of it? So first cause, of course, which is my platform on YouTube, totally, is posture. Posture in the upper body, posture in the pelvis especially. So the low back posture really plays a big part in hyperextension of the knees. So if you have a lordotic posture, meaning your low back is swayed in quite a bit, you will tend to have hyperextended knees. If you have a flat back, no curve of your back, your lumbar spine is really flat, you can have hyperextended knees. And you can have a sway back where literally that is the posture I'm talking about, the resting, lazy posture, where you're just resting on your hip joints. And then you really do hyperextend your knees, because the whole chain of events, when you start resting on one thing, you kind of rest on the others. It can be habit, just habit, you're just used to doing it. You've done it since you were a kid, everybody in your family does it, you just kind of follow along with those postures. Genetics can play a role, because posture, if you look through your family, postures tend to be very learned throughout your families and stuff. So look around your family's posture and see if you have similar posturing. It can also be activity related. So sports activities like dance, ballet, cheerleading, those kind of things where you tend to lock your knees back in a get ready pose or a landing pose in gymnastics where you lock back to get a very stable posture. When you hyperextend the knee, when gymnasts land, you'll notice that if you're watching the Olympics, they get that hyperextended knee because it's a very stable position because you're resting on your bones. Okay, so what happens when you have this? All right, a lot of things happen. Your quads become overactive, your quadricep muscle on the front of your thigh. When you lock back your knee, that's extension, okay? But then you're just going a little bit beyond a normal joint range of motion, causing that muscle to be hypertonic, meaning it's working all the time. In response to that, I've often told you, if one muscle gets tight and strong, the opposing muscle on the other side gets lengthened and weak. So your hamstrings become lengthened and weak in that position. Your soleus, which is a muscle underneath your gastrocnemius, which is your calf muscle. There's another muscle underneath there that works when the knee's in flexion and when you're walking and pushing off your toe onto the ground to propel yourself forward in gait. That muscle also becomes shortened and your foot becomes a little bit plantar flexed, meaning pointed down. Okay, now here's the big takeaway from this. If you have plantar fasciitis, look to see if you have a hyperextended knee or knees. Okay, that muscle, when it becomes tight and that foot becomes plantar flexed, that creates a shortened muscle. That muscle, sharing the gastroc and the soleus together, share the Achilles tendon. When that muscle is tight, it will pull on the fascia on the bottom of the foot and cause irritation and that's plantar fasciitis. So if you have plantar fasciitis, go have someone check out your knee posture, your pelvic posture, and see if those things need to be addressed, and maybe your plantar fasciitis will calm down, because it tends to be chronic. Why is it chronic? Probably because you're posturing. So those are really important things to look at. Fun fact about the soleus, I have two fun facts actually. The soleus, if you hyperextend your knees, like say you're standing at church, you see this often, standing at church or at weddings, up at the altar, and all of a sudden some guy will just faint. The soleus, when you're locking those knees back, becomes very tight. It presses on the soleal vein, which stops venous return to the heart and to the brain, and then you pass out. The soleus has often been called the second heart of the body, because when you're walking along with the gastroc and you do push-offs, it pumps blood back up to the heart. And that is why we tell you when you're doing hard cardio, don't just stop dead in your tracks, because that muscle is pumping blood back up to your heart. And if you're not getting enough blood to your heart and your brain, you're gonna faint. So fun fact. Okay, other things on why or what happens with genu recurvatum is, I said the hamstrings get long, you get increased pressure on the patella. Okay, so if you're locking that knee back, okay, the patella is just a little floating bone that's right at your kneecap, and the quadriceps tendon, it's in the quadriceps tendon, and if you're locking that knee back, you're going to get pressure pushing that patella directly into the femur. And there's cartilage on the back of that patella, and if that's constantly having pressure put on it like this all the time, because when you're standing, then you're going to get increased wear and tear on that cartilage, and eventually that can lead to chondromalacia patella. So if you have that, women have that more commonly than men because of our hip angle, but it can also be because women hyperextend more than men as well. Okay, ligaments get lax. If you're always locking back and resting on your bones and your ligaments get lax. They wear out, they get a little bit loose. And ligaments are not contractile like muscles, and so they're not gonna shorten back up again and go back to normal. They're gonna stay lengthened, okay? Once you stretch a ligament, it's stretched. And then you can also pinch on your meniscus in the knee, which is the cartilage. On the front aspect of the cartilage, you'll be putting a lot of pressure, which again can cause wear and tear on those meniscus, can cause knee pain and arthritis, osteoarthritis in the knee. That meniscus wears out. So all of that from one little misalignment in the knee. So if you can really pay attention to how your posture is, we can stop a lot of pain syndromes that happen in your body. So what are you gonna do? First thing is you're gonna retrain your brain to not stand with that locked knee. It's 80% conscious when you first start, okay? You have to catch yourself, have other people catch you, have people in your family take a picture of you in your common positions that you're in throughout your day in your home, and see, am I locking my knees? Check yourself at these places all the time. The grocery store when you're standing with a cart, anytime you're waiting in line, if you're at a countertop doing something, housework or cooking or whatever. Those are common positions where you'll lock your knee. Or if you have a standing job, like a Pilates trainer, standing next to the reformer, looming over a patient or a client, you can lock your knees back, because we get tired standing for a long period of time, and that's when you're going to typically go into hyperextension. So retraining your brain. Number two, physical training. Of course, you have to have a postural assessment by someone who knows how to do it, and assess your posture and lengthen the muscles that are tight, strengthen the muscles that are weak, and reposition the pelvis in the right position. Get your core muscles strong so you can support your spine and your structure, and you won't have to rest on those bones. All right, the last thing is KT tape. This is kinesiotaping, and this is something that we do as therapists. It can help with the retraining of your mind and the muscle. So it's a stretchy kind of tape. You can wear it for about a week, 5 to 7 days usually. We'll put it on, and it just keeps you from going into hyperextension. We'll tape you in a little bit shortened positions, so it'll retrain the muscles to start contracting in the right position and keep you out of the wrong position. That's a simplistic explanation of KT tape, but you get my drift, okay? So I hope that was helpful. I hope that helped you see that one small little habit that we can have with our posture can really go up the chain throughout our body and cause problems from head to toe. So don't knock your knees. If you like this video, give it a thumbs up. Think about subscribing. I'd love to have you here. And if you have any questions, drop them in the comments box below. Any comments? things that you maybe learned from this video or something you'd like to see in the future, I'd love to do it for you. I'm running classes all the time, so if you'd like to see me online Zoom classes, I can see anybody from all around the world this way. And if you have any interest in foam rolling or anything like that, I have a foam roller book out. That's all dropped in the description box, and you can check those out if you'd like to. So thanks for joining me today. Have a great day. Bye.